Great. And with that, I'm going to transition to Elsa.
So good evening. My name is Elsa Jimenez, and I'm the Director of Health Services for the County of Monterey. I've been in my role a little over 9 years, and we're really excited to be able to be here tonight with you. I appreciate everybody coming out in this weather, and those of you joining us via Zoom. As a health department, we are responsible for ensuring that our residents have access to a variety of services, and we're really pleased to be able to introduce a new line of service for our residents. Unfortunately, with COVID and just the economy and everything, we're seeing more and more demand for our services. And unfortunately, there are some individuals that need additional supportive services. And so we're really pleased to be able to be here today to share with you some of the funding that we've received to be able to bring some critical services to our county that'll hopefully help our residents who are struggling with the mental illness and or substance use be able to be reintegrated into society and live a healthy life. So that today we're going to give you an overview of the project. If we could advance the slides. We're going to talk about the benefits and challenges that we anticipate with being able to introduce mental health rehabilitation centers into our system. We're going to share with you some preliminary draft designs that the team has put together with our architects based on experts that are helping to guide our work. And more importantly, we want to hear from you as immediate neighbors to this facility or other residents in our community about what your thoughts are, what your concerns are, how you see this as potentially being a benefit for our residents. And more importantly, we want to be able to answer all of those questions. In order for us to be able to be successful to continue to add services to the continuum of care for behavioral health, we recognize that we need to do this in concert with all of our partners in the community-based organizations, and more importantly, with our residents and those individuals that are needing and seeking our services.
So thank you, Elsa. So let's start with what is an MHRC, or a mental health rehabilitation center? It is a 24-hour program which provides intensive support and rehabilitative services designed to assist persons 18 years or older with mental disorders who would have been placed in a state hospital or another mental health facility to develop skills to become self-sufficient and capable of increasing levels of independence and functioning. And that definition comes from the Department of Healthcare Services, which is the oversight body and the licensing body. So why is this important for our county? I think it's important to understand that currently folks who are needing this level of care, our clients, our patients, our residents, are placed out of county, sometimes at very extended distances for this level of care placement. And it creates challenges for families and for the individuals to remain connections to their families, their natural supports, their community, when they're at these distances. And so it's in addition to being able to create an option to have local placement options for Monterey County residents to keep them connected to their family, their system, and hopefully help transition them, up and down levels of care more seamlessly without extended stays in inappropriate levels of care, because there are situations where we have individuals under an LPS conservatorship who are waiting for beds. Referrals have been sent. There's bed shortage and capacity issues across the state, which creates challenges for folks. And so there is a need to improve that patient flow to make sure that the folks are receiving the right level of care services when they're ready for that, to make those moves and those steps. Also, with sending folks out of county, having a place here locally, even if they do need a higher level of care placement or even perhaps a state hospital placement, having facilities like this here in our community creates a way for them to step back down to their community, reconnect with their families, their network of support, and local providers here to as we're transitioning them back into their community, and just aids in the overall care coordination. Currently, the way it works is we have public guardian conservator staff as well as behavioral health staff that follow them in placements out of county and travel on a regular basis to make sure that they're receiving the appropriate level of care and doing those assessments for when they're needing to step down, et cetera. There is also a known shortage of this level of care placement in the Central Coast region. So not just Monterey County, but Santa Cruz, San Benito, SLO, Santa Barbara, just the whole Central Coast region is really in need of these placements. And so this facility would enable us, or these facilities would enable us to be able to not only help Monterey County residents, but also residents in our neighboring Central Coast counties with sort of a regional approach here. So how we got here, this started back in February 2023. Behavioral Health submitted a grant, Behavioral Health Continuum Infrastructure Project grant, and was awarded a little over $20 million. And the intent at that time was to renovate a wing at the rehabilitation wing at the old county jail. And so we applied for the funding with that as the intent at that time, and were conditionally awarded it, went to the board, got approval to enter into an agreement to receive the grant funding. And then in February 2024, we're informed that that was no longer a viable option and the sheriff's office needed that for their own purposes. And so we, health department, had to put our heads together, and then also with Natividad to pivot and identified the vacant parcel, undeveloped parcel off of Constitution there across from the Salinas Regional Sports Complex and sort of adjacent to that corral parking for Natividad as the viable option here on the county campus. And so we engaged with our public works facilities and parks partners and did some preliminary assessments. Went to the board a couple more times in 2024 first to kind of report on the need to pivot from a renovation project to a new build, and around the sort of rethinking of that. And then also back in November, as we were looking at the budget, rose significantly from going from a renovation project to a new build, and reporting out on that, and got some preliminary approval for debt servicing as a possible option there to fill the funding gap. So then in December, realizing this, behavioral health continued to look for funding options for the project and applied for BCHIP Bond Round 1, or Behavioral Health Infrastructure, Continuum Infrastructure Project Bond Round 1 application, and got preliminarily awarded $31 million to increase the bed capacity for the project. As we ventured into further conversations with our public works partners, did more study, and got other folks familiar with the San Mateo project, the Cordilleras project, which is really a similar setup with separate 16-bed mental health rehabilitation centers. We really leveraged the design, the resources, the knowledge, their learning for this project as also a cost-saving measure. And then also it also allows for billing for Medi-Cal with this model. So as we really engaged with all of that and looked at those designs, it really wasn't viable to increase the bed capacity. And so we have gone back to the state and asked for a modification for that Bond Round 1. And we are waiting to hear back from them, but everything is looking really promising that they're going to approve that, so that we would have a total of $51 million in grant funding to go towards this project. So the other things just worthy to note that we've been working on is this project was added to the county's capital improvement plan for 25, our fiscal years 25 through 30. And then also CEQA is in process, and all of the preliminary designs and things are still in process. So this is the parcel that we're talking about. This is the area. You'll see where it is located, right there off of Constitution. And the views that we're going to be showing you here in a minute, I'll be calling out some which are the view from the corral parking lot. So if you can see where the dirt sort of parking lot is there around the red, I don't know if we can, this isn't online, well, I don't know if if we can kind of show where that is, because we'll be showing here in a minute. For those in the room, perhaps we'll be showing some of the vantage points we'll be calling out are going to be what it looks like from that angle. Here we go. And so early design concepts, really, this is intended to be therapeutic treatment space, not institutional. The focus is really on helping folks rehabilitate, get the support services that they need to recover, and then step down to lower levels of care. So it's really designed with open natural light designs, blending into the community, having sort of park-like setting in between the buildings with walking paths, etc. And so here is, and we have blow-ups for those of you that are here in the room out in the hallway, so that you can feel free to look at those a little closer afterwards. But this is the proposed layout. Fabricio, can you point to where that parking lot is over there? Yeah, so that's the Natividad Corral parking right there. So you can see where the MHRC A, B, C buildings and the support building are on the back part of that lot, and then D, E, and F are up front. And as you can see from this landscape, draft drawing here, there is intent to have lots of green space in between there, with the parking that's needed for each of the facilities for staff or folks who are coming there. But there will be a buffer of the landscaping between the project and then the end of the parcel and into the residential areas. And so here's another rendering of that. And this project is based on, you'll see up there, the red outline is really the entire project is part of phase one, part one, because we have to build the infrastructure in there. This parcel is undeveloped. There's no water, sewage, electrical, like there's nothing. It's a completely undeveloped parcel. And so doing all of and our public works people are here and can speak more eloquently to all of this, but doing all the environmental studies and all of the traffic studies and everything that has gone into this parcel, and then looking at how to bring in all of the services, the water, the sewage, the electricity, the PG&E, like everything that needs to go in is all part of phase one, part one. And MHRC's A through C, as well as the support building, would be the first part. And then the buildings D, E, and F would be phase one, part two, would be for those buildings. But all the groundwork for the entire parcel would be part of phase one, part one. And so this is the view. This is one of the views. But this is a view that really takes into account looking from where that parking lot is right now down towards the facility. So you can see kind of how the buildings are lined out, how there's space in between the buildings, and it's really landscaped out with greenery, green space, walking trails, and they're single-story buildings. So I know that was a question, and a question that we heard is, are these single-story buildings or two-story, or what do we expect? So they are all single-story. Here's another vantage point, again, looking down from that parking lot area down through the property, and then you could see the buildings on each side. And then here is more of an up-close visual for one of the facilities. And you see, if you look down in the front, you see two entry points. One is a staff entrance on the left. The other is the public entrance into the MHRC. And again, with the landscaping. And I do want to point out that the courtyards where you'll see the fencing around, those are the secured courtyards for the residents. And then here's another sort of street level look at it, the building from that vantage point. And I would just say the cars and the people who are in these renderings are here for a purpose to show you scale. And so without that, you would be like, well, how big is this or how small is this? And so with the architects and folks who develop these for us, it's really adding people and trees and cars in there to give you an understanding of size and scale. And here's another vantage point. And again, these are blown up outside the room as well. Okay. And so here, when we're looking at the floor plan for each of the 16-bed units, you'll see it's probably hard to read the lettering here, but the blue is really the resident rooms. So that's the rooms, and there's semi-private rooms, a few private rooms, and there's restrooms in the bedrooms, of course. The yellow is really the shared living space and therapeutic space and treatment space, activity areas, their dining areas. The orange is sort of the back of the house staff areas. And then the green is the outdoor courtyard areas that are the fenced in outdoor space. And then here's another sort of design of the footprint of the building with some of the landscape, the draft landscape design. And so again, to give you a picture of the interior and to scale with some folks here in the pictures and a little bit of furniture. This is kind of in that center activity area, and sort of the center of it with the wings of the residences going off to each side. Here's the dining activity room, and where you see that roll-up door and the sort of collage on the wall. That roll-up door opens up into the kitchen area, and so that would be for like the food service for the residents. Here's a draft rendering of what a semi-private room would look like. So there would be a desk, bookshelves, the beds, of course, and then there is a restroom off to the side as well. And then here is like down each of the wings where the rooms are off of, there is like a shared lounge living space or activity space as well. We did mention a support building for all of this, and that would support all of these buildings. And here's the draft floor plan for that. As you can see, there's a kitchen in here. It's set to be like a commercial grade kitchen that could then help do the food service or do the food that could then be delivered to each of the facilities to then serve the residents. That could be an option there. And then as well as sort of the other mechanical maintenance, all that other supportive services to support the functioning of the buildings. And this also would be where security for the MHRC campus would be based out of. There's also some conference room space and office space for folks who work out of this building, or also for the operators of the mental health rehabilitation centers to have meetings or training, or for our county staff to meet with them as well. And here's sort of a little elevated look down at what the support building draft rendering looks like there. And then this is a street view of that as well. And so now I'm going to pass it over to Fabricio to take us through a little bit of the cost.
Great. Yeah. Thank you, Melanie. So yeah, that's an important part of this conversation too, right? So talk about the cost, where this project started back in 2023 when it was a renovation project. So that was estimated at $45 million. And then back in November 2024, when we went back to the Board of Supervisors, we presented a projected project budget of $75 million. So the main reason for the increase at that point was we were switching from a renovation to a new build. And that cost was estimated by us, the health department, a rough order of magnitude based on a recent project that we had completed, which was the Alisal Integrated Health Center. And however, since then, we faced some additional challenges. As noted, that budget was a rough order of magnitude, and some of the things that kind of contributed to that cost increasing now, it's the fact that that parcel has no essential infrastructure. There's no water, no sewer, no power, no data. Also, we had tariffs that started earlier this year. There's cost escalations. There's additional offsite improvements that need to happen on Constitution Boulevard as part of the project. There's additional increased cost in the construction field across all fields, actually. There's also a construction and project contingency in the project. So that's approximately $25 million. It's 20%. And then additionally, there is CEQA mitigation measures that costs that are still to be determined. So all these different items kind of contributed to the cost increasing from $75 million that we presented to the board back in November of last year, a year ago, to a new revised estimate of $172 million, which is based on an engineers and architecture team that estimated the budget. And here's a little bit of a breakdown of what that $172 million are made up of. And again, just want to highlight the construction and project contingency of $12.7 million each. And then the other side of the coin, the project finances. So those $172.4 million currently have funding, which include the BCHIP Round 5 that Melanie talked about earlier. That's $20.1 million. That grant had a 10% match requirement, which the county was able to leverage the value of the property of the parcel. And then additionally, we have the BCHIP bond round 1, the $31 million, which we are waiting to hear from the state about approval. But as noted, we've received verbal approval. We're just waiting for that letter to come from the state. And then that has a 10% local match, which the county will be leveraging Mental Health Services Act or Behavioral Health Services Act starting July 1st. So we're going to use capital facilities and technology needs. So that's $3.1 million. So essentially, the project has $54 million available to cover some of the cost. We still have $118 million gap. We presented to the Board of Supervisors back in November, $54.8 million to potentially be covered through debt service, whether that's certificates of participation or loans through iBank or any other vehicle. And then we find an additional $63.3 million, which we need to find some funding for. And then here we have a project timeline of, again, where the project started and where it's going. So earlier this year in the summer, we finalized our floor plans. We are doing public outreach. And then we presented to the Board of Supervisors back on October 28th. We're going back on December 9th, as Melanie mentioned. We hope to have the environmental review completed by spring 2026 if the board approves this project to move forward in December. And then late spring, early summer 2026, we need to find or secure the funding for that $118 million gap, with the hopes to start construction in summer of 2026. I'm sorry, construction contract process in 2026 and begin construction in early 2027, and hopefully have the project completed in the summer of 2029. And I'll pass it back to you.
So, I also serve as the county's conservator, and I've had the opportunity to go visit many of our residents who need to be housed in a facility of this in the Central Valley and Southern California. And it's very sad to see that many of their relatives are not able to go visit them because of the distance, because of the funding, et cetera. So what a tremendous asset to be able to have those individuals who live in our community. There are neighbors, there are friends' children, others, to be able to house them here in our community and receive the services that they need to hopefully transition back into the community. So we can't stress enough just how important it is for that individual, that family, and more importantly, our community, to ensure that we have the appropriate level of services for all of our residents. It'll not only serve as an asset for our residents, but also residents in surrounding communities that need this level of care. We've shared with you where we are right now in terms of our project budget and timeline, and our ability to be able to pay back the debt with the rendering of behavioral health services, because I know that's one of the concerns of our Board of Supervisors is, will the department be able to pay back any debt that is incurred to be able to construct this facility? And we open it up now. We thank you all for being here and joining us on Zoom. We want to hear what questions you have on the proposed project. We want to hear your feedback on what we've shared with you in terms of our timeline, in terms of the draft renderings. And we also want to hear from you in terms of how you would like to continue to keep yourself updated on our project. As Fabricio mentioned, our next public meeting to the Board of Supervisors is going to be on December 9th at 1:30. If that changes, we'll make sure we update our website, and please put your email or other contact information on the sheet outside so we can use that as a means of keeping you informed as well. So who would like to go first? At this point, no. That the county does not have a lot of vacant land. We'll just hold that so that the people on Zoom can hear. And so this is really the best location. It's on our county campus that houses many of our other services. It has your main health department. It has our county hospital. It has probation, 911, et cetera. And that is the ideal location for this type of service.
Are other counties paying for this service also?
Not for the actual construction, but as Melanie indicated, our hope is that many of these beds will also not only meet our needs, but we'll be able to contract with County of Santa Cruz, County of San Luis Obispo, San Benito, others, because the number of beds in California for this type of service are very limited. And unfortunately, the demand across the state is much greater than the availability of beds.
And if a person is coming from another county like San Luis Obispo, how is that different for them not being able to travel here versus where they're being sent to now?
Do you know where San Luis Obispo County residents are being sent to?
Well, we're all competing for the same beds in the same facilities. So Central Valley, Southern California, Sacramento area. There's a finite number of facilities that provide this level of care and the beds. And so that's why there's some delays at times in getting them placed, is because we can have contracts, and we do. We have contracts with numerous facilities, like 11 different contracts for like 23 different facilities, and speaking, but something to that tune. But just because we have the contracts doesn't mean that they have a vacant bed. And so we're sending folks out. Other counties are also sending folks out to these same places.
But that won't change the the perspective that you're talking about, a family member having to travel or unable to travel from another county to this facility, that'll still be the same scenario for them.
However, it's bringing beds regionally to the Central Coast region, and we regionalize a lot, right? Like even with Santa Cruz, Monterey, San Benito, like services are kind of here in the central area, which is a little bit more manageable for folks than traveling some of these extended distances out of the Central Coast region.
Is closer to San Luis Obispo County than Merced County or Sacramento County. And so, yes, it's not in their own neighborhood, but it is within closer proximity so that the families in those communities can hopefully also visit their loved one while they're receiving the rehabilitation services that they need.
And what is the plan if you don't secure the funds to complete the projects?
So on December 9th, our plan is to present to the board and update also the feedback that we've heard from our door-to-door campaign, as well as these listening sessions that we're holding. And it's really going to be up to the board whether or not they allow us to go after certificates of participation to cover that gap that Fabricio shared. Without their approval, we wouldn't be able to move forward with the project. Thank you for very thoughtful questions. That's okay, I'll run. I didn't get my steps. I was in an all-day meeting today.
Thank you. My name is Yolanda Hayes. I'm a neighborhood watch here in Creek Bridge. And believe me, I know what's happening here in Creek Bridge. I'd like to know the people making the decisions, how many of you live in this area? How many of you have a creek or homeless living in your areas, in your backyard?
I do live in Primdale and I live close to Manzanita Park, so yes, I do.
So
live
one.
in homeless encampments.
So one. Okay. All right. Okay. So, you know, when you brought over the share center, which everybody touts that's a great success, it's not a success. We live here. I've been here since 2009. So I went through all that process of the share center. Same thing was said. Oh, it's close to hospitals, close to jails, close to services. When I think about that, I think don't even use that, please, for the people that live in Creek Bridge. Don't use that. What happened when the share shelter was put by the Veterans Park? The homeless followed, all the in-house followed. Now, when they followed, Creek Bridge was beautiful prior to that. Now, everywhere it's a disaster area, everywhere. And I haven't gone to the Board of Supervisors meetings yet, but I'm working right now with change.org. I have a petition there because they're ruining our area. Now, how does this facility, how does this compare to a Tuscadero, the state facility that you have there, or that's there?
Atascadero is a state hospital. That's the highest acuity level of care. And mental health rehabilitation center is much lower than that. It's not a state hospital level of care. And we do have 11 beds for our LPS conserved at state hospital level of care. And we do have those full as well. And so there is also the need to have those level of care beds for clients when they need that acute level of care, but then also have the lesser acute beds for folks when that's appropriate as well.
So why isn't the state taking on this project here? Why is it going to be a county project rather than a state? Is it just because there's going to be a lot of people with conservative that are in the hospital now that need to be moved from hospitals?
I think unfortunately what's happened is that the state has actually closed down some of those most high level of care state hospital beds.
Right.
And what they're doing now is making all these grant funds available to local county organizations and others to be able to construct the facilities that are needed in their own communities, in their own neighborhood. But as Melanie said, this is much lower level of care. And these individuals can be rehabilitated and reintegrated into our community and step down into lower levels of care like outpatient care. Whereas in a state hospital, unfortunately, those individuals are at much, much higher acuity and may never be able to step down.
Now, you're telling us that there's not enough available land in other counties. So Monterey County is going to be the hub, which I predicted many years ago that it was going to be the hub of caring for everybody. Is that right? You have no other land but this land?
So I can't speak for other counties and why they chose or not chose to apply for state funding, but in our county, whenever we see an opportunity to be able to bring in state or federal dollars,
Bring them to the Northeast.
to be able to expand programming, expand services, we do seize that opportunity. And it's very rare when the state makes millions, billions of dollars available to local communities to be able to build supportive housing, rehabilitation centers, et cetera. And so, our goal is to make sure that our residents have the full continuum of services, whether it's in this space, whether it's in primary care, whether it's in public health.
Okay, so this was the land that was available, and I've been to Marina several times to look for a place to live there. And I see that they're building and building and building.
So this parcel is county land. So when I talk about vacant land, I'm talking about land, and I can defer to my partners at Public Works Facilities and Parks. This parcel is county land, and that is where we would look first as to where we have available a vacant parcel that could be used for future projects.
Mhm. Well, what happened with the shelter and with having the jail here, all the counties where people are arrested, they go to this hospital here.
Mhm.
And then they're let go here in this area. So our numbers have really risen. I met a librarian today from Santa Cruz, and he was touting about, oh, our homeless population is going down. Our mentally ill, there's not as many as there used to be. We can walk down the streets and it's all safe for us. Where are they going? They're coming here. They're coming here. Please open your eyes and look and see what you're doing to this beautiful community that we had less than 10 years ago. And now it's all a disaster. I'm fighting for the creek right now because it's full, Gavilan Creek, because it's full of unhoused people. If you go down there, you see what's happened to them. Now with the navigation center being closed probably early next year, where are they going to go? It's going to get worse before it gets better. And I don't think it's going to get better because we need housing. We need more housing for our population, and a health facility this size could fit in another county. Anyway, that's what I have to say right now.
Thank you for your comments.
We discussed the last time at the Board of Supervisors, the cost of this project and the fact that we have plenty of old brick and mortar buildings that already have infrastructures. The jail wasn't a good option. How about the old county hospital? I'm sure it had 92 beds. When you guys talk about 200, you guys, I think there was a quote of $19 million a year to run this facility for 92 people. That's the county spending $272,000 per person to house them. That was on the board. That was for running the facility. And that doesn't even have anything to do with the 174,000 or $1 million that we're taking on. And that's without the interest on it. As a county, when we know that all of our Medi-Cal and Medicaid is definitely being cut, all of our food funding for this county and all the country is being cut. And I feel like we need to feed our children first. We are going to have starving children in Monterey County, and I think that we need to put this project aside for now and work on our immediate concerns as a county and not house 92 people that aren't even going to be 92 residents of Monterey County, like you guys discussed. We might have 60 of our county members, and the other we're going to be paid for by other county facilities. And I have a feeling that we'll slowly trickle out Monterey County people because the other counties will pay us more to house their people, because you guys said that money would go back into your budget if you guys met your demands for the year and there was extra money being made, it would go back into your guys' budget. So I feel like this beds will end up going to the highest bidder and those who can pay the most. And again, you guys did not bring this out in 2024 to discuss it with us when we had more options on the board or more time to discuss it. You guys hid it for 16 months. Alejo asked you guys to present it to us, and now you guys are making a push and acting like we should be happy you're coming to discuss it with us now. I've lived in this county, this area since 1999. I've worked at Natividad since 97. I've lived in this area. I walked to work. I used to enjoy walking in this area. My complaint was that you guys have run all the homeless out of downtown by taking where their facilities downtown, that they put big bricks and big rocks around the railroad track, which, as John Steinbeck mentioned, that's where the homeless have lived all this time. Well, they're out there now digging it all up again and running the homeless out. I just went by there today. The bulldozers around the railroad tracks, taking out all those cement blocks and displacing the homeless again, and they're all moving their stuff. And where are they moving? And no, we do not have to be the hub. We're a family hub. And now you guys are building this huge soccer field that we're going to bring all these people in, and yet you're taking away the beauty of our area by building all this. Don't we have enough with the jail and the hospital? I get approached by people coming out of the jail every Sunday asking to borrow my phone and stuff at 6:30 in the morning in the dark by myself. And these are just jail inmates. How safe am I going to feel when we have a mental health facility right behind my house? It's just not right. And I don't think you guys have just covered all the areas in this county, brick and mortar that's already there, that's just going to waste.
So,
Beautiful Gatlin Creek that used to be walked all the time. Nobody walks it anymore. It's destroyed. The city and the county destroyed it. And we need to bring it back to life. People used to enjoy going for walks there. You can't anymore. The police won't go in there. I call the police several times and they say, oh, the city says it's not safe for us to go, but it's safe for us to live around the, it's ridiculous. I finished.
okay. Hello, my name's Dolores Valdivia. I was at the supervisors board's meeting. I'm against the project. I did have people come to our home. We spoke with them. They were out in the rain sprinkling on that morning, Wednesday afternoon. And I appreciate them coming to the home. My question is, why did it take 16 months if Supervisor Alejo said, reach out to the community? I feel the only reason anybody's reaching out now is because you were reprimanded at the Board of Supervisors meeting. So that's something that I'm just like, well, why didn't that happen? Especially for the residents who, like us here live, our fence line is going to be where the parking lot is. Also, so it's going to be a secured building, but then you see there's walking trails. So if it's a secured building, who's going to be walking the walking trails? Yeah. So
If you remember the design,
I'm sorry, I think you're being a little bit disrespectful to the.
no, I'm definitely not being disrespectful. But I also know what it's like to go visit a client who is unfortunately never visited by their loved ones and is not able to move on a path for recovery. Do we have a housing crisis? Most definitely. Are our homeless, our unhoused residents increasing? Most definitely. And why? They don't have a job. They might not have a home. They might unfortunately be self-medicating, and then they end up showing up in Car Lake. I've been to Car Lake as part of cleanup, and so I've seen it. And you go into Chinatown now, the demographics of the people that are unhoused there, they're getting much, much younger. And it's because they're not ready to receive services, or we don't have those services available for them here locally. The security is within the facility. Once somebody is admitted into the MHRC, they are going to be there. Staff are going to come in, provide the services that they need. They're not going to be able to go in and out of that facility until they've met all their treatment goals, and then will be released back into their home, wherever they may came from. If they came from a manzanita or they came from other type of housing, they will be transitioned back to that place. They will not be allowed to move from a housed, safe situation into an unhoused situation. I hear what you're saying about our inmates. We've been trying to build bridges and have continued to build bridges between behavioral health and our sheriff's department to make sure that there's somewhat of a warm handoff. When we We know who are in the jail that are our clients because at the intake process, we share that data to hopefully make sure they have the right medication information for them. When they're getting ready to be released from the jail, we try to work with them so that they let us know so that we can help that individual. Is the process perfect? No, of course not. But we are trying to work to make sure that when an individual is released from being in an incarcerated setting, that we get them back into outpatient services, that they get the medication that they need, and that they go back to their housing situation. I don't know if you wanted to add anything else to that. And I get it. I know that there was a lot of concerns about the Share Center. I just recently visited the Share Center. I can tell you that people that are living at Carr Lake are not the people that are being served at the Share Center. The people that are served at the Share Center, unfortunately, lost their housing. Many of them are families with young children who are blessed enough to be able to live there versus in their car or in the streets. When I went during the day, most of them were at school. They're out working, but they're not making enough money to be able to afford an apartment or a house, or there just isn't any availability. And so
Can I
these
ask
are,
a question?
may I finish my statement? So these
Sure.
were families
No,
that would
that's-
probably be out in the streets if we didn't have the Share Center there supporting them and trying to get them back and get them into a safer housing situation. Yeah, were you done, ma'am?
Is this working? Oh,
Okay.
yeah. No, no. If you're
No,
not
yes,
done, go
please
ahead.
finish.
Well, my other question was, so the security is going to be in the support building. They will
No.
not, no?
The MHRC, so if maybe we can bring that.
So my question was, is every building gonna have like a security kind of hub? So that they can be overseeing what is going on in that building instead of just at one place and then they're looking at cameras or
This
something?
is a great question. Thank you for bringing that up so we can clarify. The security office is based out of the support building. So that is where, sorry, I'll stand up. So that is where like their equipment would be when they change shifts. That's where like the cameras would be for the entire campus. But the security are out milling around the entire campus during their shifts. Each of the separate standalone MHRC buildings are staffed 24/7 with staff from the facility as well. And it is a secured, locked facility. Each of them are. And then there is the larger campus security that is, yes.
And is the security going to be like security officers? Is it going to be police
So
officers?
it's just like Natividad campus, right? Natividad has hospital security. Here in all of our clinic buildings, we have security. So it's that same level of security that is there. And the hospital, another 24/7 facility, has security 24/7. So same thing in terms of the campus model for all of the MHRCs.
It's a huge staff necessary though to take care of 14 patients at the TICDAT. I talked to the director of nursing a week ago and she expressed to me that she didn't understand how we were going to man this and pay for the staff for this because she said,
Yeah.
we don't even fill our 14 beds at our mental health facility all the time. And the cost and the expense, I don't need that. And when you call for Mr. Man overhead, help comes from all over the hospital to handle and manage assaultive behavior. So you're telling me these people are going to be being taken care of and trying to get better, but when they are having outbursts or having a bad day, who's to say that security, one person or security in the building will be enough? And I was under understanding this was going to be enclosed completely to where we would not be seeing them and they wouldn't be seeing us. And I wouldn't have to worry about them watching me walk by in the daytime. I mean, this is going to be an open campus. That was not my
So-
understanding at the board of supervisors meeting.
So the campus is open. The buildings are enclosed.
But the,
Fail.
but
Ask my
the,
engineering husband, doors fail, especially in mental health.
but the, like grass areas will not,
Things will not be outside of the walls or fenced area of each MHRC.
okay. So my last thing is, I do agree that a building needs to be built like this, but in a residential area. I just don't feel that is the best space for it, just because there is residential behind, on the side. And one thing that I shared with the people that came to the door is I don't think that you know of the noise that is there from the street, from the soccer fields, from people having parties, having banda music till like 9, 10, 11 o'clock at night. I mean, especially in the summer, there's a lot of noise. So is that going to be the best for your campus? I don't know. I do agree it needs to be built. I just I think the where it's going to be built is not the best place for it. There's a lot of concern because there's a lot of families that live around there. There's a lot of elderly people. There's a lot of people or single families. I also think if I was to be home alone and there's this campus, I would not feel secure. Even if it's a secure area, I would not feel secure. And that's why I shared at the board, I shared with the people that came to the door, I'd move. I'd move immediately. As soon as you guys get that, I'd move because I don't want to put myself in that situation. We've lived there in our home for about 15 years. We've renovated it, got it perfect the way we want it, and now it'll be a shame for us to have to move because of this. And that's all I have to say.
May I? Is this working? Well, before I, s- so yes, thank you. Okay, so first I'd like to say that I am not trying to, wasn't trying to single you out when you said that. When I said what I said, I just would like to, I'd like you to understand that people who live in this community, we have serious concerns. And so when you hear somebody saying, well, hopefully me, it kind of makes light of the situation. So I just want to clear that up. And I'd like everybody who actually works for the county or works for parks or any of those who is not a resident here to put their hand up, if you don't mind. Who is not here as a resident, but is here as somebody, okay, yourself and yourself. How about the gentleman here? Okay, so are you here as somebody who is presenting information? Okay, so then you're included. Anybody else? Yourself and everybody back there and yourself. And so the reason I'm asking that is, nobody knocked on my door. I'm hearing that a couple of people had their doors knocked on. Nothing has been sent out by mail.
So we can answer that question.
No, hold on.
Okay.
I'm not ready for that. Okay. And so nobody has really reached out to people in this community. The reason you're hearing those who do know here express their opinion this way is because there's a great distrust between the community, the city, and the county. The former county board of supervisor who we had, Mr. Phillips, did not pay attention to this community. He was very arrogant. He made decisions that did not impact him because he lived over in the other part of North County. Even though he was supposed to be representing us, he did not represent us. Many of us chose Glenn because Glenn has been much better at representing us, and we hope that he continues to represent us. We have been ignored. Now, it isn't a matter of people not needing services, but what it comes down to is constantly, well, this is the property that's owned, and so we're going to put it over here, and we're going to put that over there, and we're going to stick that over there. And so it's a matter of equity and everybody in the county sharing the same, putting themselves out to address these needs. I'm sure that people who go into those facilities don't all come from the poor side of town. They come from Carmel, they come from the peninsula, they come from all over the place. So why is it that this community is the only community who gets the shelter, who gets the hospital, who gets the prison? And when I say prison, it's because there was that project, let's stick a prison footprint over here, but fill in the hole behind the hospital, and we're going to stick that over there. And we have people from the prison industry coming and presenting to us. Don't worry, you get to pick the model. That's so insulting. We live here. I've lived here 30 years. probably more now. And I have seen continual, as it was presented by others about when we moved here. When I moved here, I knew that jail was there. So nobody can call me a NIMBY. I knew that jail was there. I knew that hospital was there. Okay, I can live with that. But let's not stick everything else over here. And that's what's happened. There's the soccer fields. Nobody bothered to ask us. Somebody's making money off of that. Because let me tell you, kids who play soccer, they can play soccer anywhere. Now we have all that light pollution. You're talking about bringing this project in, more light pollution, more traffic, more impact. It's true, nobody takes walks anymore in those trails. And, if you don't live here, you might think, well, those people really sound, well, you know what? We have a right to the value of our homes, just like anybody else. Every time you guys present these projects and you put in more here, I didn't oppose when at one point they wanted to build apartments here. And I said, you know what? People need houses. I'm not going to oppose that because some family is being housed, and I'm all for that. But to hear, well, there's families, and do you know who those families are? But we're not talking about a facility that's going to take a family in. We're talking about a facility that is going to take mentally ill. And when it comes to the mentally ill, they're not always treated well. Many times the police officers, if they're not shooting them before they take them, then they take them to these facilities. People are given drugs. They walk around dragging their legs because they're on Haldol or all these other things, okay? But basically, it's about respect for this community. Who reached out? Who reached out? Who knocked on doors? I mean, it's as easy as sending a notification to every household, but that's not happening because when you don't tell people and you hope they don't show up to meetings, that's why you have such a small crowd here. And it isn't that people here don't respect the needs of people who are suffering from substance abuse or other mental health. It's not that at all. So yeah, I can say, well, ma'am, these people, they need, and you know what? And their families, we all understand that. But are we the only community who could take on one more project? Are we? There's county owns land over by Laguna Seca. I hear these great projects. It's true, they do on 68. And there's other property that they own. But try to put it over there, see what happens to you. All those 68 people are going to come after you with a pitchfork. And because we have a nicer community here, it's easier to put it over there where those poor people are. It's easier to put where the farm workers live. It's easier to put it over here where this working classes. But don't go over there where the people are driving the BMWs and all this other stuff. No, they're fighting right now a housing project across from Tarpey that the county wants to put in housing. They're fighting that. And you know what their argument is? There's deer in the area. That's their argument. We're just fighting for a quality of life here. That's all we're fighting for, a quality of life. We have such congestion here. We have schools in the area. It is true. Nobody wants to walk the areas anymore. And that wasn't the case before. People don't want to go shopping at Safeway at night anymore because there's people running in and out of there. And it isn't that I don't want to help somebody and give them a handy help, but my God, if I handed a $20 bill to every person who asked me, I wouldn't have any money to pay my own mortgage. So is this the only community? Really is what it comes down to. More light pollution, more traffic, more disrespect. Nobody's reaching out to us. Police officers, heck, a lot of people don't even want to call the police anymore because they don't know what they might do to their loved one, especially if the kid's got mental health issues. They might shoot them instead of giving them the services they need. So yes, you may have these grants out there that are available, but do we have to, what I see is the same thing, sort of what I saw with City of Salinas. City of Salinas, they wanted to hire more police officers. And so they looked to this grant that was out there. It says, we'll give you more funding, 2 million, I think it was, for more police, but you got to stick them at the schools. So in order to get it, you got to go to the school and you got to say, hey, we'll put police officers at your school. But it was really just to grab that funding. And I kind of see something similar going on here. Is there's funding, but in order to get that funding, you got to do this. But in the end, where does the funding go? Because a lot of this goes straight to police officers. And the majority of the budget, the city council, goes to the police officers. We have a sheriff who the last, what was a year ago or so, right after she got elected, put in a load of overtime addressing a storm situation for 2 weeks. Pajaro, $68,000 in her pocket from overtime when she's a salaried because somebody put some provision in for the county that they could apply for overtime. So I'm just saying, I am asking for notifications to every household in this area. And I am asking for meetings at every school. And I am asking that you have some respect for this community and not just sell us a story about, well, these services are needed. And if we don't get this money, some other person's going to get this. Because I have heard that so many times. I heard that when the county was trying to, the same story when the county was trying to put a garbage burning facility in Gonzales. They said, oh, but we need this because it's some new technological advancement and it doesn't burn garbage, bunch of bunk. There's no such thing as disappearing garbage and it doesn't go somewhere. Okay, no such thing. And in the end, they were wanting to bring in garbage all the way from Southern California, Northern California into our area, which would pollute our air. So it's a matter of respect and talking to us like we're educated and smart adults, not selling us a sob story and not selling us, oh, you know, this others. We're too smart for that. But number one, please notify the rest of the community because I can guarantee you, you'd have a lot more people than just 6 or 7 people sitting here. Thank you.
So thank you.
I agree with Margaret. I didn't really know of this listening session until I saw it on Nextdoor. And then when I saw it on Nextdoor, I called my representative and inquired about why weren't the Creek Bridge residents notified. Like Margaret mentioned, I'm sure there'd be more people here listening to what's going on. And he told me he wasn't even aware of it. He just was aware of it 2 days ago. I go, I can't believe it. So I asked him, you know, rather than have it here, that we should have it at Alvarez High School or Creekside School, elementary school. So he said that he might have, he'll put something together for us Creek Bridge residents so we can discuss the situation. Well, oh, excuse me. He did try to make it, but evidently, I guess because he wasn't aware of this meeting, Aurelio. Oh, he's not. Oh, well,
He's here.
oh,
Turn around.
Yeah, he couldn't make it because there's a situation with the Baranda turnabout. Yeah.
He is here.
You must have just walked in. So but I'm not just talking about Aurelio. I'm talking about Alejo should be here. I'm talking about Glenn.
Supervisor Alejo is on Zoom.
great.
Unfortunately,
Great.
he is not feeling well, but he is on Zoom. And if you saw me texting, that's who I was responding to his questions. So he is here.
And when I'm saying that, I'm not trying to put anybody on blast that they're here or they're not here. I'm simply saying that we need our county reps here and we need our city reps here and not just Aurelio. We need Gloria here too, because this is close to her proximity as well. And we need the representative from across Laurel and the representative, that Brajas young guy. We need him here too, because cross the road, that's his district. Just cross Constitution, the soccer fields, that's his district. So
We can definitely reach out to the city council members as well. Thank you, Councilmember Salazar, for being here with us today. This is the first of several sessions that we are planning to have. And, you know, we do have the Zoom option available as well for those who don't want to travel in the evening.
Sure. Yeah, so that is this on? Okay. Oh, let's presume. Okay. No, I did. I did hear about this meeting literally like 2 days ago. So it's a big frustration as a city council member, right? Having to learn about this 2 days ago and having to go through my city emails to see whether or not if I had any missed email communications. So the county dropped the ball. The county dropped the ball in terms of communicating with our mayor, communicating with our city council members. And so, yeah, it is very upsetting. And the minute that I learned about it, was able to reach out to a few neighbors and residents. I can say that years back when the warming center was being proposed, there were several of us that were in opposition to it. A number of residents in the Creek Bridge area like opposed it. And I think the message is this, and I think what we want the county to understand is this. We want a residential neighborhood, right? It's what we want. We want a residential neighborhood. We understand that you own the property, but something that the county should start thinking about is either a land swap or selling the property of the city of Salinas so that the city of Salinas, because a lot of us that drive by that area, a lot of people, we forget, right? Residents will forget like, oh, that's county property. And I bet if you ask like, what does that boundary look like? I don't think anybody in this room, and I'm sure council members, and I'm sure the mayor, I'm sure our county supervisors could not tell you where that is. By pursuing something like a land swap or allowing the city to purchase the property, it gives the city, right, and its residents, the residents who elect its city council, to decide how they want that best used. And so over and over again, residents are saying, hey, we want housing, right? And it is concerning to a lot of us in terms of like public safety, right? In terms of like the city's perspective, right? And I feel like I'm gonna probably reiterate what Margaret was saying, but in terms of how we want and how we envision our city, isn't one of these. The other point that I wanted to bring up is, again, it feels like the problem, it's also at the state level, right? Because years ago, whenever it was decided that it was no longer to help those that had severe mental health issues, it was, they closed shop and they started dumping it on counties. They just push it on the county, right? Let's push it on the county. We'll promise you a little bit of money, right? Which is what county elected officials are doing. They're chasing the dollar. It's small money. And then they say, you know what? We'll give you some seed money to start it, but then you sustain it, which means the taxpayers end up having to sustain it. And we're saying no, that is not the city that we want to see, right? That is not the vision that we have. We want to see healthy, safe, vibrant communities. We want to see housing. We want to see parks. We want to see walking trails. We want to see bicycle lanes. Those are the things that we want. We don't want to be commuting home, right? And it's like, oh, okay, like, constantly, as a parent having to explain to my child, oh, we live by the jail. And my children are asking, well, what's that about, right? And they're little ones, or that's a mental health, facility, and explaining that to them. And then take my children around the county, and then we take them over, right? We take the 68, right? We get into the Monterey, and it's a different community, it's a different environment, different services. And what gets frustrating in all of that, when we see that, it's like, the county, has thrown around the term like equity, right? Like, we want to be fair. But then at the same token, it's like, we'll just dump all the social services in Salinas, and we'll protect the peninsula. And, it's not just the deer that Margaret is talking about, right? It's other protected species and other protected plants. It's the environmental racism that they use, right, to maintain the lettuce curtain, right? And so what we want is that. So in terms of going back to the county, I know that we have 2 other meetings lined up, and I've gone through this for over the last 20, 25 years, these kind of meetings. I don't know how many sort of meetings I've been like this, where county staff goes back and they say, oh, we had 3 meetings.
Right.
And we had over 100 people give us input. And here were like the 3 main concerns. But then you bombard it with the 10, 20 reasons why you want it or need it, because you don't want to miss out on a funding opportunity, right? And so that is the frustration that a lot of us have here. And some of us, we know the playbook. This decision has already been made. You're wasting our time. The decision has already been made. This is the dog and pony show. that you're going to go back to the board of supervisors and say, hey, we met with the community. Oh, only a few disgruntled people, right? Naysayers said no. It was like 20 people saying no, but we didn't hear from the rest of everybody. At the same time, we don't know about it, right? It's like, throw it on KSPW, throw it on KSMS, right? Throw it on Univision, throw it on the regular television stations, right? Have it in the community, have it at a school, not in your, backyard, your county facility. Oh, you come to us to voice your concerns. So we are concerned. We don't want it. That needs to be the message when you go back to the board of supervisors. We don't want it. Thank you for the funding opportunity. The county can push it back, right? This initial project is what, to serve 16 and then an additional 16 thereafter. It's like, really? Some of us are going to want to know, okay, you're going to serve a total of 32 individuals on an annual basis? 96?
That's
What is
worse.
that going to cost? Serving 96 on an annual basis. What is that going to cost? What is that dollar, the operational value, the operations, the salaries, the benefits, the expenses?
Right, continue it on us.
19 million. And then comes the sustainability and how does that get achieved? So yeah, those are some of the things that we want. We want to be informed, and we want the county board of supervisors to know where we stand.
I want to add something to what I said earlier, and that was regarding the whole mentality of, let's put it over there on the east side. After all, there's nothing but a bunch of farm workers. And you know what? For the most part, that's the population you have here, and you have a working class here. And then with everything that's going on in the nation, there are a lot of people who probably don't even want to leave their house to come to a meeting because they're scared. Okay. And so we're dealing with that as well. And I'd like to mention that at a council meeting not too long ago, a business owner from the South Side, got up and said, and I can name that person, I'll just say their first name starts with an F and their last name starts with an S, got up and said, regarding the homeless, why don't we just stick a whole bunch of tents over there at the facility that's by the veterans, the warming facility. Said the county can just stick a whole bunch of tents. Why? Because they have a business on the South Side. They live somewhere over there. Again, same mentality to the city council that they probably figure favors them. Why don't we just they literally said tents and put all these people over there. That's the way they think of us. And you know what? We're done with it. We are freaking done with it. And I echo the message going back is hell no.
Let me get you the microphone. Sorry. To make sure that people online can hear you.
So I saw from the timeline that you'd started out at the old jail, the decision, and then a year later it was decided that wasn't going to happen because it was no longer available. But nobody could explain to me why it was no longer available. All I heard was the sheriff at the time decided it wasn't usable for us anymore. And then that's a third of the cost, 1/3 of the cost of the full project. Plus people would be in a lockdown area where the rest of us would feel safer about it. And do the mental health actually have to be in a brand new spot, clean, big building, or an old building that would do the same trick, just refurbished? And I would really, really like to know from the sheriff why we can't use that building. Well, that's what I heard for laundry and education, but we built them a brand new facility, a huge facility that should have already included those services. So for them to then hijack the other building and say they can't give it up for a project that's needed for this city, I just don't think that's right, that she's costing the taxpayers another $100,000 to build a brand new brick and mortar building instead of using what's there. So if somebody could figure out and let us know at the next meeting why that's not available, I would appreciate that. And that's the last I have to say.
Thank you.
Get them here to answer that question.
Sorry.
Those counselors that are going to service the clients, they're not going to be local people. They're going to be outsourced.
No, so typically what we would do is we would go out to RFP for providers Yeah,
What's
request for a
RFP?
proposal, through the county request for proposal or RFP process for people who want to expand to this area. So like I said, we send people out to these facilities that are operated by different providers like throughout the state. So if there is a provider that wants to respond with the proposal to run the 16-bed MHRCs and expand to this area, then they would be responding with their proposal to operate the facility for us through a contract process, and then be hiring local people to work in the facilities would be.
Sorry.
It would be through contract provider.
No, that's all. So, I'm asking, because I'm all about like problem solving, right? It's something that we need, that you guys are saying that we need, right? Would it be like people that do live in that neighborhood, would there be Charlie gets better if they build that placement in another setting other than the one that's being planned?
Yes.
Okay, yeah, that's kind of what.
I mean,
Sorry, if you're speaking, can you close your close to your microphone? Okay. Hear you online and
Put it
get
closer?
translated. Sorry. Thank you.
But outside of Salinas or in Salinas, like you guys? Yeah, my question was like, I'm all about problem solving, right? So it's like, they're telling us it's a service that we need because we're sending these people out to other counties to get service, right? So my question to you guys would be, they're telling us it's a service that we need, right? So would you guys feel better if it's like on another, if it's billed in another location other than the one that's being proposed?
Already got a warming facility. Now they want to bring that in. We can't constantly be, like was said, which is true. It's been said, a dumping ground. And it's not that we think that people are garbage, but all of these projects, they're treated like garbage. It's just go stick them over there, and we treat them like garbage. There's no respect. So no, I mean, enough is enough. Let somebody else take a share. Propose this, like we said, we'll go with you and we'll be on your side. Let's go to 68 somewhere and propose it over there and see what happens. Yeah, I mean, Pebble Beach, isn't there a property over on Pebble Beach? You could raise the fee. Excuse me, you could raise the fee going into Pebble Beach from whatever it is and put that extra cost into the mental facility. How's that? There's plenty of tourists that go over there, and there's plenty of woods. You wouldn't even have to look at it. Let's try that.
So thank you, everybody, for all of your comments. I would like to, because this is a hybrid meeting and we do have folks who have joined by Zoom, I would like to, if you're all okay with this, pausing and pivoting so that we can see, Marty, if there's anybody who is on Zoom who would like to ask a question, and if they could raise hand. On Zoom, we could unmute them so that they can ask their question.
We do have quite a few questions in the Q&A section. I'm not currently seeing any raised hands.
Okay, can we invite anybody who is on Zoom who would like to raise their hand and answer a question? Otherwise, because there is a lot of questions in the Q&A in Zoom, we can always take these back and then prepare answers and put those out as like an FAQ as well and bring them back to the next session. Because I'm looking through these, and some of these we've already talked and have been answered here live. And then, but I do want to just, give folks who join by Zoom the opportunity, if they have a pressing question, that they would like to raise their hand and be heard.
We have a raised hand from Niquinity.
I'm sorry, Marty, I didn't hear you.
We have a raised hand from Niquinity.
Okay, can you please unmute her?
Hello, everyone. Can you hear me?
Can we raise?
Hi, can you hear me?
Yes, just a minute. If we can raise the volume a little in the room. Go ahead.
Hi, everyone. I just wanted to take a moment to appreciate the voices in this room and just coming together to share your thoughts and just feedback about this project. I'm here actually just as also a community member. I happen to work for behavioral health as well. But I just wanted to kind of put a little bit perspective out there just from a personal experience, because I just think it might be helpful to get some family member um, kind of uh, sharing. And I'm pretty open about my story. Most people who meet me will hear me share it because I think, I have something to contribute. And so anyway, I am in the mental health field. I do work for behavioral health, but I am also a family member whose mother has schizophrenia and happens to also be conserved and also is not conserved in this county. I actually have to travel to visit my mom in the facility where she resides and where she gets full treatment. My mom has been institutionalized most of my life. I grew up in foster care, and it's been quite a journey to go through the mental health system to advocate for services for my mom and to also have her receive care. And my mom is not someone who has ever been luckily hasn't had to experience homelessness. She doesn't use substances. She's not violent, but she is gravely disabled and unable to take care of her activities of daily living. And so I just wanted to put that personal sharing out there for all of you here, because as a behavioral health provider and someone who works with people who are conserved, it's really near and dear to my heart that there is consideration for a facility or facilities that may take on the care of people who are the highest risk for homelessness and for not being able to have supervision or meals and given to them daily and someone to monitor their medications. I have a depth of gratitude for providers who do that kind of work, including many of you community members who also work in the health field. So I just wanted to put that out there as a different perspective for this type of meeting, as I know there's quite a lot of disappointment in the lack of information sharing or advance notification. But I came to this meeting because this is a passionate project that I think, would serve to help so many people who are at risk for being homeless. And I just want to remind this group that they're humans too. They have their own challenges and their own needs, but it's so important that we don't forget, how special it is to have someone care for your family member who is also in proximity geographically to you. I do again travel out of county to see my mom, and honestly, I wish she could be closer, and that is something that pains me. But I'm grateful I also have other family members who, we all share the responsibility, and we all take turns to make our visits as meaningful as possible when we are allowed to go up and see her. So I just wanted to share that with the group here. I know this project brings a lot of uncertainty and can be scary for many people who don't know a lot about mental health or feel that there's a stigma around it. But as a personal uh, family member and a community member, I think it is a project that is worth considering, even though it does put an impact on the community. we provide, Natividad and Monterey County provides quite a lot of services for people with mental health challenges. And, I can say that, a lot of my colleagues work really hard to try to serve people so that we can help them find housing and also to, find a community and a place where they can feel accepted and cared for. So anyway, thank you for letting me share.
Thank you for your comment.
I also saw a raised hand from Kate. It's lowered now, but I'm not sure if she would like to re-raise her hand. Okay, she did. Go ahead.
Oh, she just put a comment in there. Kate, did you want to speak live? Oh yeah, her hand is raised again.
Through, oh, there you go.
Oh, I'm sorry. I think you can hear me now. I had can you hear me?
Yes, we can hear you.
Okay, great. I can barely hear you. That's okay. I just want to fully support what we just heard. And I think that we need more than one facility in this area. I live off of Highway 68. I understand some of the comments, but they're not all about deer. They're also about congestion and also about the affordability of a building in that area. I 100% support reusing existing brick and mortar. But I think and I have some family experience with this, we are totally under-resourced in our needs for mental health support that's not just scary people. That's all.
Thank you. Thank you for your comment. Are there any other folks joining us via Zoom who would like to raise their hand and ask a question or make a comment? I
am
think
not currently seeing
I'm
any.
not seeing anybody else raise hand, but I do see there was a lot put into the chat and there were some comments also made in the Q&A. So we will take all of that back. And if there were questions that came up that haven't been answered or discussed, we'll bring those to the next community session, which is Monday evening at 6 o'clock, the 17th.
We do have another one scheduled for December 6th at 10 a.m. That's a Saturday one.
So it looks like we have one final question here in the room, and then we will be closing it out.
I wanted to ask about the process, but I also, I just kind of find it ironic that the person speaking out is the one who's on 68 in favor for it. What is the process from here going forward? So this group is totally against this. And I'm sure that if you knocked on more doors in this area, which is residential, which has been pointed out, and we would like to keep it residential, we'd like to be respected as a residential community and not have people feel like they need to leave, because this also causes insurance costs to go up on our housing. It does. That's just the way the system works. Okay. It's bad enough that we're dealing with all these additional costs right now. But what is the process? Where are you going from here? Where are all the votes you need to take? You need a vote from city council. You don't need a vote from city council. You need a vote just from the county board of supervisors, correct? And you have already done a presentation to the county board of supervisors and you were reprimanded, slapped back for not getting out to the community. So you're attempting to do that now. Okay. And then, so going forward, this group is opposed to this. And going forward, what will stop this project? No votes from the county board of supervisors, correct?
So about a year and a half, we did hold a couple of community meetings at our new Alisal Integrated Health Center when we were first thinking of rehabilitating the old jail. And there was mixed concerns, right? Some people were in favor, yes, we need this service. Sentiment is like, why is everything being concentrated over on that county land in the center of Salinas? And honestly, we didn't know if we were going to be able to move forward because of the fact that we spent over a year designing a project that unfortunately then was not able to move forward. As was mentioned before, the sheriff needed it to expand their own services. They just created some a rehabilitation space, and we didn't have the money. But then we were able to receive additional grant monies, and so then we worked with our county departments to see if there was another parcel. As you saw, there was a lot of changes during that process. We made several presentations to the board during that time, but still no certainty. And even now, yes, we've secured $51 million, but it's a big price tag. Is this a service that's needed? Most definitely. Does the county have does the county own other county land that could be utilized? Probably not, in terms of what's available. And so the board gave us preliminary approval to continue to keep down this path of planning for it. I own it. We should have done more community outreach and engagement. I own that, and I've told Supervisor Alejo that we're doing it now. But honestly, I think we would have received the same message back then. And where we are right now is we have some draft designs. We have done some financial pro forma where we think we could make enough money off of the facility and within our behavioral health services to help pay that debt back, and would add a tremendous asset that's needed. And if we had another place that we could build it, we probably would be looking at those other places. So where we are right now is we'll continue to hear from the community, their concerns, hear their input. We'll share that back with the Board of Supervisors, and we won't water it down, Councilmember Salazar. And I'm sure some have joined today, more will join the other community meetings that we're holding, and it'll be up to the board to decide whether or not they want to continue to proceed with this project at this location and take on that debt that then the department would be responsible for paying back over a 30-year period. So on 12/9, they will tell us either no, stop, and so then we'll have to figure out the several million we've spent on designs to date, how we will cover that, and we will notify the state and return the funding, and there will be no MHRC built in Monterey County.
So can I ask you, because a minute ago in your explanation, you said that you own it, that you didn't do the outreach earlier. And to be honest,
We did some like a year and a half ago, but it was not enough. And that's because we didn't know if we were going to continue or not continue with this project.
yeah. And you said that, to be honest, you probably would have gotten the same response.
Well, we heard similar comments at that point.
Right. And so it sounds like when I hear you say that, it sounds as if that you don't take it as serious as you should.
Oh, I take it very serious, but I also recognize the need. And I see,
yeah,
I
but-
see the unhoused individuals. I see the people that unfortunately are incarcerated. And many times it's because they have untreated mental health services. And I would rather have somebody in a mental health rehabilitation center than in an incarcerated setting receiving the services that they need.
But what you're not doing is when you say all of that, and what I hear you saying, it's about money. We have access to money. These services are needed. These services are always going to be needed, just as Mr. Salazar pointed out about problems that we've had with state and how, mental health services, how that has been not addressed and then not addressed. But again, it comes back to the services are needed. So like it or not, we're going to go forward with this. And when I heard you stating what I hear from you when you said that you should have done more outreach early on, and you said probably would have been about the same. What I read into that is that you didn't do it so that you could go farther on down the line, spend more money on it, and then have more commitment into the project so that when you present to the County Board of Supervisors, instead of tackling the community early on and getting the pushback and getting a no, it's, well, we already spent, it's like when you get a car and it's a lemon and you put so much money in it. And so you don't want to give up the lemon. So you keep pouring more money into it. I sort of hear that from you. But again, it's not all. I want you to understand, and just like the person who called in, who was sharing her need about her mother, it isn't that this community does not care. I mean, we care about, there's so many things to care about. We just don't think that we're the only community that could bear the burden of all these things, because they do become a burden. And that's not to say people are a burden, but let's be honest. I mean, are we going to put every jail there? I mean, we've already got the jail there. And so it's going to be another project and another project and another project. That's just what it's been. And so there's no trust because the county continues, county reps, such as yourself, people who work within the county, continue to disrespect the community because of what you don't want to hear. So you're making a grab for money. You've made a grab for money. So how do we?
So we also do positive things. How many of you have seen our brand new 2-story Alisal Integrated Health Center?
This isn't about that. We're talking
so
about that. You're
deflecting.
And
No,
that's
I'm not
disrespectful.
deflecting. No, I'm sorry. I'm
Deflecting.
sorry, Miss Margaret. I'm not
What
deflecting.
aboutism?
Our role as public servants in the county of Monterey is to ensure that our residents have access to all the services. That is our role. And if we have an opportunity to be able to construct a new facility, whether it's a behavioral health clinic for children and families with an integrated primary clinic, whether it's in Salinas, in Marina, wherever there's an opportunity, that is what we are going to try to do. And it is unfortunate that the county owns a big parcel of land that's all concentrated around here. But there are no other opportunities. And so it is, I can't predict what the board is going to do. And if ever there is a need again, we have some draft plans that we could pick up again and see if there's another place we can construct them. I would love to build housing, but we don't have funding, and we are not funded as a health department.
You to build anybody's house.
But that's what we need. We need more housing. Unfortunately, our homeless, so in January, the Coalition of Homeless Services Providers is going to be doing their point in time count again in January.
You're saying that because people don't have houses, you're going to stick them in a mental facility?
No, what I'm saying is,
I don't
what I'm
understand
saying is that
has to do with this.
What-
I see a deflection.
no,
You're
no,
trying to bleed my heart right now. But
no,
it's not
I'm not.
working.
I'm not trying to bleed your heart. If there was another county parcel, we would have explored that as an opportunity. But unfortunately, there isn't.
Well, I'm sure there's other uses for that parcel.
Well,
It
it is
doesn't all
it
have
is
to
slated
be
for
about
health
that.
services. It is slated for health services per our board of supervisors. I would love to build a brand new outpatient primary care clinic, a brand new outpatient behavioral health clinic, so that Natividad has access for additional expansion of services.
I don't mind the idea presented about the land salon.
Mhm.
But that's if we could trust the city too.
I'm sorry, ma'am. I'm sorry.
So in all of Monterey County, from Pajaro all the way down to wherever the line is, and there's not one other parcel?
Florence, can you help me answer that question?
So I think for this particular project, there was a need to find a parcel that was co-located next to the services that was mentioned.
And close to infrastructure.
And close to the infrastructure. So that, I think, health department identified that parcel because of the co-location. English, what does that mean? Meaning that this particular parcel on Constitution is next to the hospital, it's next to the health services that are private. So that is why it was an ideal location for this project.
Were there any other explored? Any other land explored?
Was there any other land explored? Was there any other land within the county explore aside from this side?
The main other location that was looked at, as you know, is the existing reuse of the old rehabilitation center at the jail.
So I will just say, I do want to note the time. I want to note that we have a couple of people who have raised their hands and have been waiting patiently online. And so I would like to pivot to them. And then, so I believe we see Sandra Bautista has her hand raised online, so let's unmute Sandra and ask for her question or comment.
Sí, buenas tardes.
Sí, sí, le escuchamos.
Ok, bueno, yo estoy a favor de, claro, que se haga el centro. No, no me opongo. Nosotros somos conscientes de que todas las personas tenemos diferentes necesidades, pero al igual que los vecinos que se encuentran ahí, también nosotros estamos pues con mucha preocupación porque de hecho nosotros somos personas que vivimos a espaldas donde quieren hacer este centro. Y la verdad es que nuestras casas están en un poquito alto y alcanzamos a ver esa parcela fácilmente. Y el hecho de que sea un lugar tan abierto, nos preocupa mucho. Nosotros tenemos 3 niñas, la mayor tiene 12 años, la pequeña tiene ni 2 años. Y nos preocupa saber que en algún momento van a encontrarse o van a mirar una situación, pues no tan placentera, ¿verdad? Que tal vez exista, pues no sé, algún tipo de agresividad en el centro, que salga hacia afuera y podamos estarlo mirando constantemente, porque no podemos taparnos los ojos y decir que no va a pasar. Entonces, no es que a veces esté uno en contra, simplemente podemos buscar, podemos mirar, podemos apoyar en tratar de buscar la mejor manera, el mejor lugar para que pues todos tengan una ayuda, ¿verdad? Todos tengamos algo cerca, porque en algún momento también se nos puede presentar a nosotros, pero creo que sí debería tomarse un poquito más de tiempo y considerar un poquito más la opinión de nosotros los vecinos, sobre todo esta parte de aquí arriba donde estamos nosotros. Gracias.
Gracias por sus comentarios. I can just summarize real quickly. In essence, it sounds like she's a resident in that neighborhood. She's not necessarily opposed to the idea of adding this type of service to our county, system of services, but she does share some of the same concerns that the other residents in the room shared with respect to visibility, security, et cetera, et cetera.
Hand raised online. Go ahead and unmute Abel.
Hello?
We can hear you. Please go ahead and ask your question.
Okay, yeah, I was just going through the the city of Salinas website, and according to the record, they keep talking about how there's no infrastructures, there's no other properties. According to the website, there's a 307 on-record properties owned by the city of Salinas. One, two, Fort Ord has a lot of government property that can be put out there, you know? And second, coming from a retired law enforcement correctional officer, you guys were talking about how some of these individuals need families and they need the support, which they do, but also in a same token, speaking with inmates, for over 31 years, a lot of them will tell you, in order for them to get change and improve their life, they need to get away from the same environment that they're in. And you still want to house them in the same environment with the same families. There's got to be a better option than that. You want to speak about, supporting with the family and all that, which is all great. But once again, we got to think about the victims. And like the lady was talking about earlier, how secure is this building going to be? In the last couple of years, since 2016, I believe, the county jail has had, what, 3 escapes? And they're supposed to be a secure building. Who are you housing there? How are they going to be housed? Is it long term? Is it short term? Are they sex offenders? All that needs to be detailed. Because we have enough problems already on our own just with the county jail. And now you're going to flush this community with even more. Look into Fort Ord. The government will give you some land out there.
Okay, thank you for your comments. All right, so I think we have one final comment here in the room, and then we will stop for today.
Thank you. I just cannot believe there's no other land opportunities from San Benito all the way to King City. I cannot believe that. Is it that landowners are not giving up the land, or you want to be in this kind of area where there's hospitals and stores and communities so everybody can just live happily together? Is that what you're looking for? Because I told you that doesn't work. As this lady, respectfully, I say, she said it's because it's close to all the facilities. There's a hospital, there's a jail, there's a there's already a mental hospital in Natividad. Um, it's close to stores. Ask Safeway how happy they are to have all these people living there. Just loads, carloads of food they were stealing. And escaping, having a secured place. I agree with the gentleman that just called. The secured jail that you have here in Salinas, they've escaped many times, and they find them in the creeks hiding. So it's not that secure. It doesn't matter how much security you have. Even in Prunedale, I'm sure there's a lot of land in Prunedale, not just Manzanita Park. There's a lot of land over there. I would negotiate with some of those landowners, and county land isn't always the answer. Um, take the soccer field, for instance. They passed it along so they could build a soccer field. And the soccer field said they were going to be sustainable. They weren't going to ask anybody for money. Well, just this year, they came back and asked for over $1 million. So getting the land is the cheap part of it. Maintaining and sustaining the property that you're getting, that's the difficult part. And it gets costlier, and uh, that's where the problem is. You're not going to be able to sustain this kind of facility. And it's like everyone says, we care, but we have been the dumping ground, and nobody takes us into consideration. They don't care if our neighborhoods, and I would say it's District 1, 2, 4, and 6 that are affected. Those are the ones that are mainly affected. And that would be Tony Barreras, Luis Barajas, Gloria de la Rosa, and Aurelio Salazar. Those are the districts that are most affected. And it's not just Creek Bridge, it's the whole community. High school students don't jog anymore. They're afraid to walk. So it's the land. I'm sure we have plenty of land. I'm sure Fort Ord would give us some of that land. I still remember when the council member that made the decision for the share shelter on Laurel, it's a no-brainer. There's a store, it's community, there's a hospital, there's a jail. So as I mentioned earlier, every individual from all this county of Monterey, when they bring them to the jail here on Natividad, they end up here. So our population has grown for the mentally unstable, the at-risk youth, all these people, and we want that to stop. Please respect us.
Thank you for your comments. Thank you for everybody for coming out today. We will be back here Monday evening at 6 o'clock. And please, if you want to take a closer look to any of the things out in the hallway, please do. And thank you for your time.
We will. We will.